Near 70 degrees. Okay, it is First Cup with First News, and each week we go live from a different location across the Arklatex. This morning, Hollis Dental Care, right there at the corner of Benton and Wimple Road here in North Bossier. I'm being joined right now by Dr. Bernard Hollis. And Dr. Hollis, thanks for joining us this morning.
Good morning. Thanks
Good
for
morning.
being here.
We've been here before. Great little office you have. I say little because it is. It's nice and cozy. Tell us how that is significant in your business here.
Right. So our main goal here is to make the patient feel comfortable. We have a smaller office setting, one doctor. You're going to see the same ladies or the same doctor every time you come in. So that way, hopefully, we get a little more of a feeling like home.
Right.
Somewhere that makes you feel comfortable, not, sending you through the cattle chute.
Yeah, and a lot of the bigger offices now, you have 5, 6 doctors. You've got many assistants. You've got a lot of office personnel, and they're not going to necessarily remember who you are. In an office this small, this kind of environment, it still has that small town feel to it. Correct?
Absolutely. If we can get to know our patients a little better, we can build better relationships.
Excellent. And also coming up in just a little bit, we're going to talk about ways you can enjoy that appointment when you come out here to see Dr. Hollis. Maybe you have a toothache, you need to get a filling or a cleaning, whatever it may be. And you may not be so comfortable with going to the dentist. Some folks are that way. Well, he's got ways to make you feel comfortable, make you feel at home. We're going to be talking about that. Talk a little bit more now. We've already talked about the office itself. It's a kind of a small town office. You've got your one doctor. You don't have 5 or 10 doctors and 15, 20 different assistants here. Makes everything nice and simple and probably a little bit more relaxing for the patient too. But also you have, we're all familiar with this, right? You have toothache, you go into the office, you go, oh, is this going to hurt? Is this going to hurt? Is this going to hurt? Oh, no. We have blank to help you out, to calm you down. That would be laughing gas. Tell us about that.
Sure. So, 3 out of 4 patients have a fear of going to the dentist.
Oh, yeah.
That anxiety, that's a very normal, natural thing. So
it's the unexpected.
Absolutely. I don't like being in that chair, particularly myself.
Of course.
I understand it. So we have laughing gas that we use for a lot of our procedures just to kind of help relax you a little bit, knock the edge off, and make you a little more carefree about being here.
Now, does that help with the pain so much, or is it just the calming? Is it just kind of calm you and kind of relax you a little bit?
It's primarily the calming, but there is also some effect with any pain you would feel is decreased by the laughing gas.
Almost like a placebo effect a little bit. Although the gas is relaxing you, you're not thinking about the pain so much.
Absolutely.
Or there might be a little bit because you're going to be apprehensive a little bit when when you start going into that mouth, they kind of start to flinch a little bit, but that laughing gas is going to kind of calm those nerves. All right, First Cup with First News. Each week we go live from a different location across the Arklatex. Hollis Dental Care, corner of Benton and Wimple in North Bossier. They are a small office where you know your doctor, and here he is, Dr. Hollis himself. We've been talking about his office. We've been talking about the space you have here, and also sedation. We were talking a little bit about laughing gas earlier, but sedation now. Tell us what that is exactly for those of us that haven't maybe been to the dentist in a while, or if you're younger and you just haven't been yet. How would you describe it?
Sure. So a lot of times we either have a patient or a procedure that we want a little extra. We want to really make the patient feel comfortable. Maybe we don't want to have to worry about remembering it all the next day.
Yeah.
And modern medicine's great.
Yes, it is.
Got things simple like oral sedation, bring the patient in a little early, let them take just swallow a few small pills, and then here in just a few minutes, they're comfortable, they're relaxed, they may even be taking a little nap while we're working, and then, a little later, they're saying, I think I remember going yesterday to that, but my spouse or friend or whoever drove me home, and so I just went home and took a good nap.
You don't have to worry about the apprehension that you're going to feel, on the way there. While you're in the office, you may not be feeling too terribly relaxed, but the sedation is going to help. And there's different levels of the sedation?
Absolutely. Like I said, there's things that are lighter, like laughing gas, but then we use medicines. I have a few different drugs we use. We don't use the same level for every patient.
Right.
We'll start with a little bit, and if we see, hey, you're not quite as comfortable as you'd like to be, or we think we can get you, safely get you a little deeper, we'll give you a little extra. Whatever we need to do to, make the experience good.
Right.
That's the main goal.
Everyone's tolerance is a little bit different. Just to make you very comfortable while you're in that dental office. And it is Dr. Hollis that you'll be visiting, by the way. It's over here on Benton Road, right there on the corner with Wimple Road for First Cup with First News. We remember, and I'm sure you remember too, going to the orthodontist, going to the dentist, and they give you this. Let me see that real quick. I want to show folks this. You remember this? You go to the dentist and they put all that gump inside there. I mean, it's full to the rim. And they come up to you, go, all right now, open up. Come on, open up. And they put this, go, ugh. The whole thing goes up in your mouth and they're getting an impression. And it has to be in there, what, 2 minutes?
2 to 5.
2 to 5 minutes.
Depending on the impression, yeah.
It felt like 20 minutes to me. And my orthodontist, he would have his hand on my shoulder. I'm sitting there in this chair. He goes, all right, Brother Brian, here we go. Be still for me.
Right.
And then that big old gump of stuff goes, ugh, right up there on the top and on the bottom. They get the impressions for whatever they're going to be doing. I was getting a retainer probably, or for braces or whatever. Now it's way different. What is it? What is the because this is out now. This is going to the antique shop.
That's right.
What do they have now in place of that?
Sure. So like a lot of other things, we've gone digital.
Yes.
We do digital impressions here in the office. More comfortable, and they're more accurate too.
Right.
So it's not just for comfort, but hey, that's for me. That's the part I want to take home. Yes, I've
much
got
quicker, I would imagine, as far as getting everything made.
Got this little thing that kind of looks like a little magic wand.
Okay.
And we just turn it on and
goes right up in there. Okay.
Take some quick pictures, and it builds. The computer builds the model from that.
Okay, that's easy enough. And no mess, no
Right.
fuss, and no
material.
having to gag on all that gump that
Exactly.
goes in your mouth. You don't have to ship off all that stuff to get the impression made for the retainer and or whatever else it might be. Maybe you're having some implants made. This would be used for that kind of thing as well.
Absolutely. This is how we take pictures of the mouth and design all of our restorations for all of our implants.
Okay. All right. Well, excellent. So if you didn't know about that yet, they don't use these anymore. They use this technology, and it's that quick. It's not 2 minutes, 5 minutes. You don't have to worry about that impression. I know I did all the time going to the dentist, orthodontist. What are they going to do today? What are they going to do today? No more worries on that.